butchers and children's clothing stores on a trial basis, not right across the country, just in some regions. Despite the ongoing reports of new cases and deaths here in the UK, the data is reflecting some signs of optimism to suggest we are working towards flattening the curve. I want to find out more about how you start thinking about loosening the lockdown. So let's talk to Dr. Mike Tilsley, who's an associate professor in infection disease modelling at the University of Warwick. Doctor, good evening.
Good evening.
Listen, thank you for your time. I mean, I find this area genuinely fascinating because it's a hell of a responsibility to decide when to loosen a lockdown. So, first off, what would a loosened lockdown look like?
Well, I mean, you're right. It is a really serious responsibility, and I mean, we're getting to the stage. We're only really in the very early stages of having evidence that things are slowing down. And I would suspect that what we will see, the challenge that we have is that when measures were brought in round about the weekend of the 22nd of March, all the measures came in relatively close together. And so what we find is very hard for us to untangle the relative effectiveness of these different forms of measures that were brought in. So what we're most likely to see is some kind of gradual relaxation, as we are seeing in other countries, because what of course we want to avoid is releasing everything, all of a sudden cases dramatically start to pick back up again.
Yeah, so I mean, we know in Italy they're looking at doing it in certain regions. Would we do a similar thing in this country, or would we look at age? How might we do it?
Well, I mean, it's very difficult for me to comment on what policy might be, but I think what's important to think about is that different parts of the country are at different stages in their own epidemics. I mean, there is evidence to suggest that London is slightly ahead of other regions. Perhaps the Midlands, the West Midlands, is also perhaps starting to approach a peak. Other parts of the country, particularly further north, may be slightly behind. So it's possible that we may think about relaxing in some places rather than others. Obviously, with age, there is very strong evidence that older people are more vulnerable to infection. So, of course, it's something that maybe should be considered, that we still need to protect the elderly and the high-risk individuals in the population.
Okay, and in terms of what people do for a living, does that have an impact? I think I'm right in saying in Italy the construction workers are allowed to go back now, although a few weeks ago I was taking calls on this radio station saying, well, we still have construction workers in London. I mean, I know you can't comment on possible future policy, but would someone's line of work be something to consider when you're loosening the lockdown?
I mean, obviously this is a major consideration, because of course we as my community as infectious disease modelers really very much focus on putting in policies that will be minimising the impact to human health. But of course there are other aspects to that, and obviously you've already talked about on your programme the economic impacts of lockdown, which are substantial. And I think these questions clearly need to come into play in terms of government policy, thinking about reasonable relaxations, thinking about sectors that could reasonably go back to work to sort of lessen the impact of that. That said, what we need to do is, when those measures might be lifted, of course, it's really important that any businesses that do go back, the sort of standard good hygiene practices and social distancing where possible remains in place in these workplaces, because again, we cannot stay in lockdown forever, and we need to think about relaxing policies, but what we need to do is try to minimise the risk of a large second wave occurring.
And in terms of the data that might be used, would we just look at using UK data, or would we look at what other countries have done around the world and maybe think, well, look, that's the impact that particular measure had, or the loosening of that measure had, so maybe we can learn from that? Or would we just keep it purely on if you like, domestic data?
I mean, we certainly can learn from that, because I mean, in a sense, people are people, but there will obviously be some slight variation in how measures were originally implemented and how they were relaxed. But certainly we can get evidence looking at China and other countries in East Asia in the first instance that are, a lot of those have already relaxed their controls, but also other countries in Europe that are starting to think about putting these measures in place. It would give us at least some guidance as to what might happen when some businesses start to open and so forth. In some countries thinking about maybe sending some school children back to school. analysing those to see what that might do and the evidence as to whether they are starting to see a resurgence in cases or whether we can keep those numbers low as those measures are lifted.
And given your specialism, what are you making of where we find ourselves with COVID-19? I mean, most people didn't see this coming. Here we are, our lives have changed in a way that most of us never thought they would. What are you learning from what we're seeing in the UK?
I mean, I think it's you know, as in our field, it's extremely hard to predict when we might see something like this emerge. I mean, of course, we're always prepared for it and always ready to respond. I think what we are learning, I mean, it's very different from, say, swine flu that we saw just over 10 years ago, in that you know, it's transmissible in a similar way, but the mortality rate is a lot higher, and it's crucially higher in the sense that we have got these, you know, serious lockdown measures in place. I mean, we're understanding a lot more as new data come in regarding how this virus spreads and what the impact of these different measures might be. I think one of the key things we're learning is how to respond and how to respond efficiently. I mean, there'll be an awful lot of discussion once this pandemic is finished, I'm sure, regarding improving our response for the future. So I think this story could run and run for some time, even once the pandemic has ended.
Yeah, and the bottom line with all of this, I should imagine, is patience, because, you know, anyone thinking that a switch is just going to be flicked and everything returns to normal is living in cloud cuckoo land. This is about being patient and a very slow, if you like, fade in of you know, if you like, reducing the measures.
Yeah, absolutely. And I think, I mean, I always remind myself that, you know, the key thing is you're not just doing it for yourself, you're doing it for other people. I mean, we all, I'm sure, have loved ones who are elderly or who have underlying conditions, and, you know, as hard as it is, and we're all suffering from, you know, over 3 weeks of lockdown now, as hard as it is, you know, I always try to remind myself personally, well, you know, I'm doing it for my elderly grandma, for instance, and that's a really, really important message that needs to get across, that we're doing it for other people, we're doing it to try to save lives and to try to protect the health service.
A real pleasure to talk to you. Thank you for your time. That's Dr. Mike Tilsley, who's an associate professor in infection disease modelling at the University of Warwick, here on BBC Radio London. I find this whole area regarding lockdown, loosening lockdown, genuinely fascinating, because we spoke to a gentleman earlier yesterday, or rather yesterday, on the radio, and his thoughts as well. He was a medicine man, and the idea that, you know, someone has got to take the responsibility, and he said it won't be someone, it'll be a group of people to actually say, right, now is the time we start loosening the lockdown measures, because it's got to happen at some point. Just think we need to be patient. 6:15 is the time. BBC Radio London, time to make a difference.
BBC Radio London, make a difference.
Hi everyone, hope you're keeping safe and well out there this Tuesday evening. I'm going to start this Make a Difference update with a request from Richmond Library Services. Now, many of you, I'm sure, are keeping diaries at the moment, even if you didn't before. It is such a significant and unprecedented period of time that we're going through. I think it's certainly worth just keeping a log of what you're getting up to and how life has changed. Well, if that is the case, and you have been writing some kind of diary, Richmond Council's Local Studies Library and Archive is inviting residents to share their recordings. It might include your daily routine, your struggles that you're going through, some of the thoughts you're having. Eventually, the idea being, when people come to study this period of time, they can then see how the pandemic really affected people's lives. So if it sounds like something you'd like to contribute to, you can head to richmond.gov.uk and read more about it there. Now, next up, the story of a blossoming friendship between a young lady called Isabella and the local bus drivers in her area. Now, Isabella